causes that pain. Now that we're getting to the root cause, we can finally get him walking again and get him back on the golf course, okay? See how I'm massaging all that edema out of his foot and ankle, which will really help his pain and inflammation as well. See that? Good. All right, good. Okay, another thing, we have to release the gastroc muscle. Can you get my foot model? The reason why is the root cause of a heel spur and plantar fasciitis is the ankle is a pulley system. This is your calf muscle tendon. Achilles tendon attaches to the calcaneus. When your calves get tight, it pulls on the calcaneus, which makes the plantar muscle tight. And then when you step in the morning, what happens? You're tearing that. And then when you sleep, your foot goes in plantar flexion, it shortens, and then you go like that, and it causes that tear. That's why they want you to wear that splint at night to keep the foot flexed. But now that we put the stem cells in there to help repair the inflammation, this will help break up the adhesions. Then we're going to put them on aggressive calf stretching at home. Here's how you stretch the calf appropriately. First, we're going to release the calf with the myofascial release tools. You feel that grinding like guitar strings? Those are all the adhesions you have are breaking up. So increase your circulation, help that edema and swelling. I'm going to kind of release the Achilles tendon here too, just like that. Okay, that's a concave tool. Let me take our convex concave tool. We could get a little deeper in the tendon there. Right there. I know it's going to be really tender. And we take our handlebars. Sorry. And I'm going to stretch your calf out as we release those gastroc muscles. And this will take the tension off your plantar fascia. Good. So I'll stretch out your gastroc for you right now.
Gastroc, what is that?
Gastroc is Latin for calf muscle.
Okay.
So I'm just going to press my body weight. Just relax. What's your limit?
Is that against the wall?
What's your limit?
What's your limit? Is that comfortable?
Yeah, well, the heel hurts, but nothing else.
Okay, yeah.
hurts.
So I'm going to hold it for 30 seconds.
Yeah. Put the heel on the floor and lean against the wall.
You're going to do it against the wall. I'm going to show you
Yeah,
how.
I've been doing that.
But you got to do it right. A lot of people do it wrong. I'll show you how.
Okay. Actually, the pain's easing off the heel now.
See? The heel feels better, doesn't it?
It's a little bit less.
Yeah, because we're releasing it already. The stem cells help the inflammation. The myofascial release tools help break up the adhesions.
I'll go to those little guys
And
worry about
the
this.
stretching helps lengthen the muscle, okay? Just relax.
How long
Just
does
going to
those
stretch
little
out your ankle a little. Relax.
How long does it take those little guys to figure out what they're going to do?
Well, you've had this for 30, 40 years. Give it a year. A year is nothing compared to 40 years with this.
Yeah.
You get about 10% better a month. So after 6 months, 50% better. I'm conservative. Get about 10% better a month. It took me a year to heal my plantar fasciitis.
It hasn't
Really?
been that way
Yeah.
for a year. For 40 years, it just
Well,
came
it's often
back
it
about-
came back.
It just
Yeah,
came back about a
okay.
month
Well,
ago.
it came back. That's it. The root cause was never fixed.
Yeah,
That's
right.
true.
I'm just going to manipulate his ankle, just get more mobility.
Wow.
Just relax
They
here.
used deep massage on the soles of my feet
Yeah.
and ice.
So here's how you properly stretch the calf, okay? Omar, could you get him up so he can watch me? So,
Oh, okay. I figured the cable up. I thought they were just pull me up.
yeah. All right, so
I
let's,
need my glasses back so I
Yeah,
can see
yeah.
now. What happened to them?
So what you're gonna do is, I'll demonstrate. We'll film it and you can watch later. We'll film it, so.
Okay. I won't watch.
Get out of the way.
You wanna help get up, Omar? So when you do the wall stretch, yeah, something good out that side. Right.
He's been doing that, but I don't know.
Well, I want to make sure he's doing it correct. So can you help him get up here? Yeah. And I want to have you demonstrate how you're doing the calf stretch.
Just careful with your step right here.
Have him grab your arm.
I can only
Yeah.
get myself leaning against something and something to support me.
Yeah,
That
you
floor's
look-
cold.
You look at me.
That floor's cold.
All right. So show me how you're doing your wall stretch for your calf.
Well, first I pull them actually, and then I do them.
Just show me. Pretend we're not here. All right. Why don't you record that?
And that's about all.
Okay. So there's a few things. All right. You want to come out here. So your foot, it has to be perpendicular to the wall. You see this line?
Yeah.
Align this foot so it's perpendicular. More. You see how more challenging that is? Put this leg forward, like you're gonna lunge like me. All right, and then you're gonna lean in and maintain a flat back.
Yeah.
Keep your head up,
Yeah.
make a curve in your back, lean your hip forward like me, and straighten your left leg.
That's straight as his foot.
Yeah, straighten this.
Yeah, hold that for about
Hold
30
straight.
seconds.
Hold it for 30 seconds. The reason why? If you don't maintain a calf stretch for at least 30 seconds, research has shown it actually gets tighter. There's a rebound, a mechanism, okay? So inhibition. So I want you to do that 30 seconds,
Yeah.
as many times as you can in a day. And then what you're gonna do is, when you feel that pain in the heel, you're literally gonna take an ice pack,
Honey, are you watching?
get a towel or a glove. You're gonna hold an ice cube, and you're gonna give yourself an ice massage right here.
This is what that chiropractor did in
Yeah.
Thousand Oaks.
Yeah, he
Yeah.
did that.
Now, when I had plantar fasciitis, if I was driving on the highway, when it would, because it's like needle-like pain, it's sharp.
Oh, yeah, he knows.
I would stop in a restaurant or a hotel. I'd get an ice. Just after a couple ice, it's free. I'd sit there, ice massage until it's melted, knocks the pain away.
Oh,
And then I do my stretching. So you're going to do that stretching, remember, as many times. I did it, I think, at least 7, 8 times a day, 30 seconds. It's boring,
The thing
Yeah.
is,
but it works.
with
Yeah.
that boot on, I can't do that.
Well, you're not going to do it with the boot.
No.
I don't want you to depend on that thing.
You want me to wear the boot?
Well, I don't want you to wear it
Okay.
because
Yeah.
I want more mobility now. You got the cells in there, and now it's time to repair that. We got to lengthen it, strengthen it.
Well, I
Okay?
was doing that stretch, about 4 sets, 30 seconds,
Yeah,
before I put the boot on,
yeah.
and then another 4 or 5 sets after I take it off at night.
Okay. Now another thing we're going to do, I'm going to have you sit right there again. We're going to stimulate those cells with the laser. Okay? Yeah, that's fine.